Welcome to Breastfeeding Support for Neonates, Managing Poor Latch and Weight Loss with Clinical Confidence. In this course, we will focus on the early days of a newborn's life, a time when breastfeeding challenges can develop quickly and require immediate, informed support. We will explore how to identify red flags in neonatal weight loss, assess and improve latch effectiveness, make safe supplementation decisions, and support parents using current Australian clinical pathways. By the end of this course, you will be equipped with the skills and confidence to deliver evidence-based, family-centred, and culturally safe care. Who should take this course? This course is designed for healthcare professionals involved in newborn care, including registered midwives and registered nurses, maternal and child health nurses, lactation consultants or IBCLCs, general practitioners providing postnatal care, Aboriginal and Torres Strait Islander health workers, rural and remote area nurses. These roles are critical in detecting and managing breastfeeding concerns early, ensuring healthy growth and preventing complications. Why this course matters. In the first days of life, challenges like a poor latch or excessive weight loss can escalate rapidly. Delays in recognition and action can result in dehydration, jaundice, or hospital readmission. This course provides you with clear, evidence-based thresholds for when to intervene, skills to assess and correct latch issues, tools to make safe, supportive supplementation decisions. Guidance from trusted Australian sources such as NSW Health, the Australian Breastfeeding Association, and National Breastfeeding Guidelines. You will leave with greater clinical confidence and the ability to support parents effectively. Module 1. Understanding neonatal weight loss and regain norms. Newborns normally lose weight in the first few days as they adjust to life outside the womb. Typically, weight loss peaks between day 2 and day 4, and a loss of up to 7% is considered within normal limits. The 10% threshold is a red flag that requires closer assessment and possible intervention. Most babies regain their birth weight by day 10 to 14. Breastfed babies may have a slightly slower regain than formula-fed babies, which is still normal if feeding is effective and there are no other concerns. In New South Wales, clear escalation guidelines help determine when feeding concerns should be addressed urgently. Why weight monitoring matters. Regular weight checks allow you to identify concerning patterns early. For example, a baby who has lost 9% of their birth weight by day 3 should already be on your radar for closer feeding assessment, rather than waiting for the 10% mark. This proactive approach prevents feeding issues from worsening and supports timely interventions. Module 2. Identifying and addressing poor latch. A proper latch is the foundation of successful breastfeeding. In this section, we will explore how to recognize whether a baby is latching effectively, how to assess the latch, and what to do when problems arise. We'll discuss common causes of poor latch, such as tongue tie, newborn fatigue, and maternal anatomy, and look at simple, effective strategies like repositioning, improving attachment, and encouraging skin-to-skin contact to stimulate feeding. Finally, we'll cover referral pathways to lactation consultants and trusted services such as the Australian Breastfeeding Association, ensuring families get expert support when needed. Signs of effective versus poor latch. An effective latch means the baby is able to feed comfortably and transfer milk efficiently. Signs of a good latch include the baby's chin touching the breast with the nose clear, a wide-open mouth with lips flanged outwards, and audible swallowing after the initial sucks. In contrast, a poor latch may show as shallow attachment with lips tucked in, clicking sounds or pain for the mother, and the baby slipping off the breast frequently. By identifying these signs early, healthcare providers can intervene quickly, prevent feeding problems, and support healthy weight gain. Module 3. Supplementation. When, why, and how. Supplementation can be an important part of newborn care when breastfeeding challenges put a baby's health at risk. In this module, we'll explore when supplementation is clinically indicated, following Australian guidelines for safe thresholds. We'll look at how to protect breastfeeding during supplementation by choosing appropriate methods such as cup feeding or syringe feeding. You'll also learn the importance of informed consent, using supportive and non-judgmental language, and involving parents fully in the decision-making process, so care plans are consistent and family-centred. When to supplement. Supplementation is recommended if weight loss exceeds 10% of birth weight, or if there are signs of dehydration or ongoing poor feeding behaviour. It's also necessary when a poor latch persists despite targeted interventions. Always follow Australian supplementation guidelines to ensure decisions are based on evidence and aligned with best practice care. Preserving breastfeeding during supplementation. When supplementation is needed, the goal is to maintain breastfeeding skills and protect the feeding relationship. Methods such as cup feeding and syringe feeding support oral skills without causing nipple confusion. Avoid teats or bottles in the early days unless absolutely necessary. Encourage frequent breastfeeding alongside supplementation so milk supply remains stimulated and the baby continues to associate feeding with the breast. Module 4, supporting parents and using Australian resources. Feeding challenges can cause anxiety, guilt, and stress for parents. This module focuses on clear, empathetic communication and culturally inclusive care strategies, especially for Aboriginal and Torres Strait Islander families. You'll also learn where to direct families for reliable 24/7 support, such as the Australian Breastfeeding Association helpline and local maternal and child health clinics. We'll cover best practices for documenting red flags, feeding support provided, and how to create follow-up plans that ensure continuity of care. Addressing parental concerns. Support begins with listening. Use non-judgmental language and provide reassurance while offering practical guidance. Be aware of cultural beliefs and practices around feeding, and integrate these respectfully into care plans to make the family feel seen and supported. Australian breastfeeding support resources. Healthcare providers should connect families to trusted resources, including the Australian Breastfeeding Association helpline, available 24/7 for immediate advice. New South Wales Health Breastfeeding Guidelines for evidence-based care. Local maternal and child health clinics for ongoing face-to-face support. Telehealth lactation services, which can bridge the gap for rural and remote families. Creating a follow-up plan. A follow-up plan ensures that early interventions are sustained. If there are ongoing concerns, schedule weight reviews within 48 to 72 hours. Offer home visits whenever possible to assess feeding in the family's natural environment. Use telehealth services to maintain regular contact. Document all discussions, interventions, and observations clearly in the medical record. Course summary and learning outcomes. By the end of this course, you will be able to identify normal versus concerning neonatal weight loss patterns, assess and improve latch effectively, so make informed supplementation decisions while protecting breastfeeding. Support families using current Australian clinical pathways. Connect families with trusted breastfeeding resources for ongoing care. Course assessment and certificate. At the end of the course, you'll complete a short quiz to test your knowledge on neonatal weight loss red flags, latch assessment signs, supplementation protocols, and family support strategies. Upon successful completion, you'll receive a digital certificate of completion, confirming 1 CPD hour in neonatal breastfeeding support, clinical decision-making and communication.